So my name is Linda Carter and I am from Fertility Solution, and I help women at all stages of their life with their gynecological health and their wish to start a family. And I'm here today with Natalie Wakim, who's going to ask me a few questions about what I do, how I work, who I help, and how it can benefit people.
So hi Linda, I'm Natalie and I'm here to see with Linda because I'm myself passed through lots of IVF and it was a really very hard journey. So I just want to see with Linda which kind of support, because to be honest, when it comes to fertility with the doctors, it's quite a bit, they don't consider it as something very important somehow, because I feel like there's a little bit of neglect when it's in hospitals or clinics or whatever it is. So what is your role to support women that going through that IVF?
Well, what you're saying, Natalie, is something I hear a lot from clients of mine. I deal with more or less three types of people. Women who are trying to get ready to start a family and they want to improve their health and optimize their body for fertility. Those who have just started to try to have a baby and they're quite shocked that it's not happening instantly, because I think that most men and women spend so many years trying not to get pregnant for whatever reason, their life circumstances, that they just don't believe that it doesn't happen instantly when they want it to. And then the third group of people are those who have tried to have a baby, tried to conceive, to get pregnant, and they've had failed attempts through assisted reproductive therapy or naturally. And each one has their own emotional issues. But I have a lot of clients who have gone down the private, or as we have in the UK, NHS route, where you're seen by a fertility doctor. They have limited amount of time, maybe 20 minutes, and they discuss with you your blood results, your scan results, what's going on now, what we should do next, when to start treatment. And most women I see are shell-shocked. They're just like, I don't understand. This is the most common thing. I don't understand. And with my 2-hour intensive, what I mostly do is have 2 hours to discuss exactly where you are now, exactly what's happening, what your challenges are, what your confusions are, where you need more clarity, and you come away from that session with an absolute roadmap of what to do next. You may come away with one particular decision. Should I do IUI? Should I go for IVF? Should I try another cycle naturally? Should I try and persuade my husband to get that sperm test that he's never had? So that is my 2-hour intensive. If people need a little bit more support, I do 4 1-hour sessions in 1 month. So that will give the opportunity to go through 1 or 2 cycles for women with their menstrual cycle, and that gives us a little bit more time to plan what decisions you need to make along the way. It's a very complex issue, as you know. There are decisions about drugs, there are decisions about clinics. Which clinic should I do? This clinic is really good, but it's very far away from my home, versus, well, this clinic's near to my home. So there's all these things to weigh up. I'm also an acupuncturist, and I think that a lot of nutrition and complementary therapy can help and support women. I also do sessions with a couple, so couples therapy together, or I can speak to a man individually if he prefers to have a private one-to-one session. And within 4 sessions, I'm happy to split that in whatever way is necessary. And I work with women quite frequently. We were discussing before this how people are increasingly facing challenges with fertility.
So much actually. It's like very rarely to hear somebody actually conceive naturally these days. Is there any reason for that?
Naturally, quickly, easily,
Not,
without...
yeah, but
Yes,
really,
yeah.
very rarely.
Yeah.
Like you feel maybe.
Well, I think some people talk about their fertility and infertility issues very openly. Other people are extraordinarily private about it. And, you know, I help people with coping mechanisms. For example, if you need to go for scans, even if you're doing natural fertility, so you may just be being scanned throughout your cycle, or you might be doing assisted fertility. What do you say when you need to leave the office every 2 or 3 days for a scan? What excuses do you make? What do you tell your friends when they say, oh, why aren't you drinking alcohol? We're having a party. You know, all of these things. You know, there are simple solutions to lots of things, but because I've been doing this for so long, I have a toolkit for people, obviously tailor-made to your particular needs, but a toolkit to be able to help you find easy answers and good direction within that. And what I wanted to say was, I just think people's lifestyles are different. I don't like this phrase, oh, well, you know, they waited to start a family. I've never heard a woman say, oh, I really put my job first and I didn't care about having children. I wanted to make £100,000 a year before I did that. Women say, I didn't meet the right person. I wasn't in the right place at the right time. I was too scared to do it alone. I wasn't in a stable relationship. We didn't have a nice home to offer a child. We're in a very small apartment, whatever it is. But I just don't hear people say, oh, I was just putting my career first. And it's very offensive. People get extremely upset by this attitude. You know, you chose this is what you wanted.
Well, exactly, you can't choose that, but sometimes again life just not easy on people.
That's right.
And you have to have the right person, you have to have the right place,
or
you can't just
feel within yourself that it's the right thing. Because there's a couple of things I do with single women, one of which is give advice about egg freezing.
Yeah, oh, definitely. That's
So it's a preservation for some people. I don't think it should be used as the alternative to, you know, being in a healthy, happy relationship, whether that's a lesbian relationship or a heterosexual one. But it gives some comfort and confidence to some people. And, you know, if women are going through that journey alone, having somebody by your side to support you completely throughout that process is very important. Knowing what, again, things you might want to discuss it with your family and friends, you might want to be completely confidential. There are all sorts of egg donor programs that you can join, so it can lower the cost of your treatment. There's just so many small things that people can do to make it easier. And the other thing, I've worked with a lot of women who would like to have a baby alone. They're 35, 37, 38, 40, and they are not in a stable relationship, and they feel their biological clock ticking, and they just say, I'm not going to wait anymore.
Yeah, exactly.
For the right man, for Mr. Right to come into my life. And so they use what's called donor insemination. Yeah. And again, this is very individual for a person, whether they're, you know, nervous about doing it, reticent, reluctant, not sure. So we go through that whole process together. And I've seen several of my patients have beautiful little babies, and with the love of their family, with the love of their parents, maybe they have a brother, a sibling, fabulous friends, and they have this child, and they just are so happy they went forward and had the courage to make that decision. So yeah, I work with single women, I work with same-sex couples who maybe two women have to decide which one is going to donate the eggs and which one is actually physically going to carry the baby. So that's another, very sensitive conversation. And then I work with couples through getting both members of the family fit, and healthy. And that can sometimes be surprising. So don't do really hard, vigorous exercise because it raises your cortisol levels, but be healthy, sleep well, reduce or eliminate alcohol, stop smoking, eat healthily, have very specific foods, and give yourself the best chance you can, because IVF is emotionally and physically and financially draining.
Absolutely, absolutely. And to be honest, they do not offer any counseling. Okay, maybe they will say that is, but to be honest, I did with great hospitals, I'm not gonna mention names, and I did with very famous doctors. And one doctor, I said, what's happening? What's up? He said, oh, you wasn't lucky. Am I like playing lottery?
Yes.
I mean, you can't tell me you wasn't lucky.
Yeah.
You have to give me evidence. You have to tell me why it didn't happen. And that's really, I thought was very cruel. And yeah, I mean, I wish I knew you at that time, but I'm happy I know you now. And I love your treatment because, again, fertility, not only fertility, but also like in everyday life and decisions, you're really very helpful, I would say, with your suggestions. But I want to ask you about the acupuncture things. Let's not the side of the emotional side, but would it increase the chances of the IVF being more successful if you do these kind of treatments at the same time?
Yeah, I mean, when a person comes initially to see me for an acupuncture treatment, I would assess their general health. And if we're focusing on their fertility, then we would aim to regulate the periods, and particularly if somebody has previously been taking birth control, to regulate the hormones after that, and then work hand in hand with the IVF treatment if they were doing that, or IUI. And if they're able to, for myself, I work remotely as a fertility coach, but in London as an acupuncturist. If they're able to, or wherever you live, I'm happy to recommend acupuncturists from a certified body. You can have what's called a pre and post implantation transfer session. So a woman would come to you before transfer, and she would have a calming treatment which also helps the blood flow to the uterus. She would go have her transfer of the embryo and then come back to see you and have a treatment which increases implantation, sends the blood to the uterus, and calms and holds. There are particular points for holding within the uterus. So there are points for this. So it goes from general health, getting ready for having a baby, whether it's naturally or with assisted fertility, and also massages that can help within the lower back and lower abdominal region. I can help you learn massages you can do with your partner to increase the blood flow, depending on the time in the cycle, whether it's up to ovulation or in the luteal phase after ovulation. And I love what I do. I'm passionate about it. I have testimonials on my website which you can read, and the best moment for me is when a client, if it's in London where I live, has brought their newborn baby to see me.
That's very amazing. That's absolutely fantastic. So where would you have your clinic, or where would you see your customers?
In London, I work in Harley Street, but for Fertility Solution, my main aim is to work remotely with couples, and we work on Zoom, or we can do a Skype call, a telephone call, FaceTime, WhatsApp, video, whatever suits people. And I work from a 30-minute complimentary call to start with, so you can have an idea of who I am, and I can get an assessment of where you are and if we are a good fit to work together. I do a 2-hour intensive. I do a 1-month program, which is 4 sessions over the space of a month. And then for more complex cases, or for people who want more emotional support and guidance throughout their whole journey, which is the most bespoke and the best package, I do a 3-month program where we have at least an hour once a week, and I'm available in between sessions for urgent questions. So, you know, I'd love to help you. I'm passionate about what I do, and please see my website, see my testimonials, my blogs in particular, explain a little bit more about how I work, and I hope I can help you.
So it is Linda Carter, it is fertilitysolution.co.uk or .com?
fertilitysolution.co.uk.
.co.uk. So that's where you can find Linda, and I promise you, you would regret it.
Thank you.
Have a great evening.